Welcome back! I'm really happy we are meeting for another lesson. Today we'll include breathing into our exercise. But first let's repeat the basic sitting posture on the chair. Knees are over ankles, feet are at the width of the pelvis, the weight is evenly distributed over them. Lights on the knees are sending parallel beams straight forward. The palms of our hands are on the thighs, as close to the body as possible. Elbows are close to the body as well. Let's gently press the palms of the hands into the thighs and move our attention to the shoulder blades, which are in the neutral position as well. Let's remember the infinity sign through the shoulder blades and the rubber band as well. The shoulders are gently pulling to the sides. Now imagine the snowman's ball through our pelvis, chest and head. Imagine the snowman's nose. This is usually a big long carrot pointing straight forward. Or imagine you have a small light on the tip of your nose. The beam is directed straight forward and parallel to the beams from the knees. Parallel means that the beams never ever cross their trajectories. To take our sitting position to the next level, imagine that someone has placed their hand over your head and you are trying to push it very gently away, upward. Let's focus on our breath now. Breathe in through the nose. Breathe out through the nose. Healthy breathing is very important while exercising, but also in everyday life. Many people have a too shallow breathing. When they want to learn how to breathe in a healthy way, they usually come across a lot of confusing and contradictory information. Nowadays, there's a tendency to consider belly or abdominal breathing as a synonym of diaphragmatic breathing and promote it as the correct way of breathing, whereas chest breathing became a synonym of shallow and incorrect breathing. In reality, it's much more important how deep you breathe. When breathing into the abdomen, it's actually possible to just pull the abdomen out and take a shallow breath. It's not true that diaphragm, which is the main breathing muscle, in the image marked with a green cross, contracts just during belly breathing. It contracts with chest breathing as well. Actually, it contracts with each in-breath, unless your diaphragm is paralyzed and not moving at all. You would notice that immediately through impaired breathing and shortness of breath. For this reason, we'll use the term deep breathing. I hope you are still sitting in the healthy position. Let's place the palms of our hands on the lower ribs. Let's close the eyes so that we can better focus on our breath. Let's take a slow, deep breath through the nose. When you take a deep breath, you will feel that the ribs underneath your hands move up and sideward. Let's breathe out slowly through the nose. You will feel how your ribs are moving down and closer to each other. And again. Deep, slow in-breath through the nose. Ribs are moving up and to the sides. Slow out-breath through the nose. Ribs are going down and closer. Please repeat a few times in the rhythm of your breath. Once you can feel that your lower ribs clearly expand on the in-breath, you can place your hands on your thighs with palms facing down as we did in the basic position. Let's continue with slow, deep breathing. Slow in-breath through the nose. We feel the lower ribs moving up and sideward. Slow out-breath through the nose. Ribs going down and closer to each other. And again. Slow in-breath through the nose. Lower ribs going up and sideward. Slow out breath, ribs move down and to each other. Please repeat a few times at your own rhythm. Congratulations! Now you know how to sit healthy and how to take a healthy deep breath. From now on, please take note of how you breathe, not only while sitting, but generally. Till our next lesson, please practice this nice upright sitting and healthy breathing. Please remember the neutral position in your lumbar, thoracic and cervical spine. Or, to make it simple, think of the snowballs of a snowman and his carrot nose. Tomorrow, a new arm position is waiting for us. We will also learn how to activate our pelvic floor, and the day after tomorrow, we'll train our abdominal muscles. I'm looking forward to seeing you!